According to Wikipedia, an emergency is an urgent, unexpected, and usually dangerous situation that poses an immediate risk to health, life, property, or the environment and requires immediate action. People typically come to hospital emergency departments due to a dangerous situation that poses an immediate risk to their health and life. Things like accidents, illnesses, heart attacks, and other culprits. Let's focus on Wikipedia's statement that an emergency requires immediate action. One would expect that a hospital's emergency department takes immediate action to save lives and preserve health. So, it is reasonable to expect that the term immediate means action is taken right away or, in a worst-case scenario, within a few minutes. Unfortunately, we have witnessed lately that emergency departments are so overwhelmed that although they take action, it doesn't happen right away or even within a few minutes. It takes hours, sometimes days, to be seen and treated. Hours or days do not fit the definition of an emergency. If we want to preserve the term's true meaning, we must demand that all emergency departments change their names. For example, to survivor care, because only those who survive the long wait will be treated. The sad fact is that this problem goes way beyond emergency departments. 20% of all Canadians don't have family doctors. In the case of a non-emergency medical issue, they have only two options: go to a walk-in clinic or join the wait at a hospital's emergency department. With the second option, they only add to the problem and cause even longer delays. So, maybe the walk-in clinic makes sense. But have you been to one lately? These are the for-profit doctors' offices that we might call Family Doctors Light. You see a different doctor each time you go there, so don't even try to remember their names. You start wondering if they employ 365 doctors, each showing up for work just once a year. What do walk-in clinics and family doctors have in common? They both practice drive-thru medicine. Focus only on one medical issue during your 10-minute visit is their slogan. You have to value their time, but they completely disregard yours. You must book separate appointments for each medical issue, which means missing work multiple times. Well, yeah, then your boss will question your health and give that newly opened management position that you've waited years for to somebody else. Let's pretend that after overcoming all the obstacles the healthcare system has prepared for you, you actually see your family doctor. What a relief! At least then you can say with certainty that your doctor is real. It's like your personal Christmas. Seeing your doctor is like seeing Santa Claus, although you probably see Santa more often. When the doctor finally sees you, you are as happy as a child. In fact, the doctor will make sure you feel like a child. As soon as they enter the room, the stopwatch begins an unprecedented race with time. It seems that all doctors have signed up for a national competition for who can spend the least time with their patients. You must be focused. Get straight to the point. Prepare your speech carefully in advance. The first two sentences are the most important ones, so they should contain the meat of the matter. After that, the doctor will stop listening or will interrupt you. You won't get a second chance to explain the issue during your 10-minute visit if you even get 10 minutes. Interesting dynamics. Before COVID, patients used to see their doctors more in person. Now it's usually over the phone or by email. But it does not matter. Whether it's in person or in cyberspace, doctor visits resemble a World War I battle. You have limited time to convince your doctor that you need to be referred to a specialist. That is your main goal. But the doctor believes he can help you himself, because he simply knows everything, and what he doesn't know, he can Google.
Drop your weapon!
What can you do in the face of battlefield medicine? Perhaps the answer is self-help. Perhaps you can diagnose yourself quickly. Find the appropriate surgical video on YouTube. Buy surgical instruments on Amazon. Have them shipped to your address. Amazon Prime is strongly recommended. And start the procedure yourself. Risky? Yes. But it is probably less risky than being on a waiting list for years, only to die waiting. Well, This situation was not created overnight, and it is not the fault of the emergency staff, doctors, and nurses. Canadian politicians whose families are perfectly taken care of, thanks to their network of friends and their privileged status, are completely detached from the reality of healthcare. In what universe do they live? Nowadays, more people are moving to Canada than at any other time in history, yet these politicians forgot to plan, hire more doctors and nurses, and build more hospitals. They failed big time. They should be fired. Don't forget that. Next time, vote responsibly.